if it's a doctor's path that I would like to tackle, go for it. Go for it. But don't do anything na napipilitan ka. You won't enjoy it. I can say this siguro for most of my colleagues in the profession. Money is not our main goal in rendering this kind of commitment or service. There's always a service accompaniment to what we do.
So, Doc, did you always want to be a doctor?
No, a doctor, yes. Doctor, yes. From my college days, being a doctor was part of my aspiration in life. No?
What is a typical day like for you?
For the most part, days usually spent, making rounds, seeing patients in the clinic, because I've not given up my clinical practice completely. And then, of course, you have meetings as part of your administrative job and responsibility. That you usually occupy several hours of meeting with different divisions, different departments.
Was there ever a time that you thought of maybe just choosing one or focusing on the other?
Never, Pia, because I felt like to be effective as a clinical leader, you need to be in touch with the clinical environment that you work in. And you need to have the pulse of the clinical group to be able to come up with policies that will be good for the clinical group as well. I think we all understand that the doctors, the nurses, the medical professionals, the ones that make the hospital thrive effectively and efficiently. So we need to make sure that clinical policies are aligned with the directions that the clinical group needs.
You said that you're actually the first doctor in the family.
I'm the first in my family, but the family I built now, I have 3 doctors.
All 3 kids?
Yeah, all my 3 children are in medicine. One of them is a full-fledged licensed physician. The second one will take the boards. And the third one is finish up medicine proper in UST. So I'm happy with the fact that I built a family of doctors.
But Doc, between you and me, were you ever were you trying to convince them ba to get into the field of medicine?
Actually, hindi nga eh. I think na-reverse psychology ko sila. Because I know many of my friends who are doctors who really make an effort to convince their children to become doctors. I think medicine and law, at least these 2 fields, is something you cannot force your children to get into unless they want it. It requires a lot of dedication, a lot of commitment. So if they want to be doctors, you have to want to be. And your parents cannot just influence you to get into it just because they want you to be doctors. I think if they can see what you are, the kind of work that you do, and they also see what they're up against in the kind of work that you do, then they will have a better understanding of the profession that they're getting into.
But Doc, was there ever a time that you thought that maybe you should have chosen another profession because it can be so difficult, it can be so frustrating and so challenging?
Honestly, no. I cannot imagine yata myself in another field other than what could have been if I were not a doctor, like architecture, for example. But no, I think this is still my calling to be a doctor and provide whatever I can in terms of healing or treating people.
That really is what medicine is. Na parang it's not just like, a career about, earning your professional fees. It's a calling. It's a public service too.
That's right. So it's really something that I value as a commitment to what I do. Of course, there's money there, wala namang. And nobody hates money, di ba? We all want to earn.
Sino bang aayaw?
Exactly. we just want to earn things properly for what we do, for the services that we render. But I would think, and I can say this siguro for most of my colleagues in the profession, money is not our main goal in rendering this kind of commitment or service. There's always a service accompaniment to what we do.
We all remember how how you handled various situations during the pandemic. It was a very difficult time for everyone, and most especially for those in the healthcare sector. At that time, when you first heard of like the number of cases in China, in other countries, Japan, ganyan, may konting kaba na po ba kayo na baka umabot rin dito sa Pilipinas?
Hindi lang konti, malaking kaba ko na darating sa Philippines yan. And just to give you a sidelight of that era that we all view as a nightmare, naging medical director kasi ako in 19.
Oh, so right before.
Around October.
Okay.
By December, we already had news of the Wuhan virus. By March of the following year, 2020, we had our first case in Makati Medical Center.
Oh.
So, what are the odds that when you took on a job as medical director, there's a COVID pandemic waiting for you? Sabi ko, maybe this is something that's really meant to be handled or confronted during this particular time. And we just did our best. But it's something you wouldn't wish on your enemies, this COVID, this COVID pandemic. It's really a nightmare, especially during that time. It's a disease we hardly knew anything about. We didn't know how to treat it. We've never been in a pandemic in our lifetime, so it's the first pandemic in our lifetime. So the impact is tremendous. You see some of your nurses down with COVID. You hear of doctors dying from COVID. You're running out of PPE, for example, and masks. You have a hospital in full capacity. And you're a neophyte medical director during that time. So all of those are competing elements of what can be a potentially nightmarish situation. But we're just happy that we breezed along and we can look back and laugh about it and talk about it. But during that time,
Hindi kaya. I sometimes feel that it was so long ago, yet it was just like yesterday also.
Right.
But
Parang ano lang siya, parang blip in our existence. 3 or 4 years have passed. And now we are looking back at it with, with a lot of lessons learned, for example. I will tell you this. Siguro third quarter or fourth quarter of 2020. So we've had COVID for around maybe 4 or 5 months. I can already feel the emotional and mental toll. I would sometimes stare at the wilderness, halimbawa, and just, what's going to happen next? You planned for something on a weekend. By the week that followed, everything that you planned for needed to be overhauled already because they won't work anymore. So when I experienced that kind of emotional and mental toll on me, I said, it's time for my team also, my management team, to get some breather from me. So we invited a psychologist to give a pep talk to the team by Zoom. I said, we need some psychological upliftment from what we are doing for the last 5 or 6 months. And everyone felt the relief coming from that maybe 2 or 3 hour session.
were there other things, Doc, that helped you through that time? I mean, like on a personal level, what got you through it?
This may sound like a cliche, but prayers, certainly. But I will tell you, there are a couple of things that made us able to go through the pandemic. And you will agree with me. If you have, of course, a family with you, your pets, internet.
The good part of the internet.
Because suddenly people were devoting time to plants, were devoting time to hobbies like sculpture or carpentry, just anything that can keep your mind occupied while you're on quarantine or lockdown. So I think on a personal level, those are the things that made me cope with the demands of the pandemic during that time.
Were there times, Doc, that you yourself had to like quarantine or parang, I mean, napraning ba kayo na baka you caught the
Towards
virus?
siguro the latter part na just, I think the Omicron virus na. But I will tell you that during the first salvo, the first siguro 2 or 3 surges of COVID, I relocated my office. I'm holding office in the hospital itself. So I had to move to the building away from the hospital to protect myself as well.
And so you can continue operations?
Exactly. So we needed to also protect ourselves to make sure that the entire machinery will go on during the COVID pandemic.
Okay. But you were still able to go home naman, Doc?
Oh yeah. Good thing for us was libre yung toll natin, di ba, namin.
Yes.
And then you have these special passes that the traffic police will allow you to navigate through because they know that you're a healthcare provider.
Do you still remember when maybe the first time you were able to breathe a sigh of relief was? Yung parang after everything that happened, at what point did you realize that, okay, we're getting out of this? Parang we're reaching the end of this tunnel.
Roller coaster tayo, Pia, nun eh. Whenever the surge will somehow improve, sabi ko, maybe this is it. we're getting close to the end of it. Then you get another surge, and then you get more cases again. We've been through the Delta virus, which is one of the worst. We had the most number of people going to the ICU, the most number of people being stranded in the emergency room because we had no vacancy, and the most number of people being intubated and becoming critical. That was one of the worst phases. So I said roller coaster because you feel a certain relief that it's over, and then you get into another surge again, so you build up the mental exhaustion again, and then you go through. We've had, I think, 4 or 5 surges in Makati Med. So each time takes on another impact on my team and in the entire community of Makati Med as well. And I'm sure in the community then.
Doc, do you think that after the pandemic, parang nagkaroon ng newfound appreciation for our healthcare workers?
I believe so. I believe so. Kasi, di ba marami nga sila mga posters noon and promulgations that these are the actual heroes of the pandemic. So, I perfectly believe so.
But I suppose that came also with a lot of frustration during
yeah.
the pandemic.
Oh, yeah. Marami.
Maraming frustration.
Marami.
How would you deal with that, Doc? Because it's very difficult. You're trying your best to impose certain measures and all that, and then there's just resistance from other people.
That's true. And resistance can come from various areas. It can come from a few of your fellow doctors or your colleagues, for example. Manageable naman yan. It can sometimes come from the community, or even from people in government. So there are things that you would like to accomplish in the smoothest way possible, but sometimes you cannot because there are some interferences that sometimes get in the way of what you want to do.